Welcome to A Stride Above podcast, where our commitment to excellence in equine health and athletic performance unites us. Join your host, Dr. Alberto Rollan, as we trot through the essential topics that matter most to you and your equine family members. With over 15 years of experience in equine sports medicine and rehabilitation, Dr. Rollan is dedicated to navigating you through the latest innovations and essential insights in horse health. Together, we'll ensure that you and your horses always remain a stride above the rest.
Welcome to another episode with me and Dr. Pendleton, our podiatry certified journeyman equine veterinarian is what we call a podiatrist. If you saw our previous episodes, I'm sure you're already thirsty for a lot of good information, and that's what we're going to deliver to you. Tons of information and great value. Thank you, Dr. Pendleton, for being here with us again.
Thanks for the invite.
And just like promised, on this episode, we are going to talk about the hated disease of laminitis. Back in the days when I was a kid, there was only a few treatments for laminitis. Pretty much one was take it to the river and see what happens. The other one was send it to heaven. And the other one was play around and see what happens. Mm-hmm. That was about it. Now, obviously, this has evolved a lot in the last several years. I still don't think we have an answer. We don't have a concrete answer, but we have many answers, right? A lot of research. We're not going to get to all of this in 12 minutes. But what I want you to do is get us up to speed on whatever you can tell us on this type of laminitis. What can you do for it? And then we'll see where we go.
So it's interesting that you say that intro, because when I was in vet school, of course, at that point I'd been shoeing horses for 15 years and I had run across a fair amount of laminitis. I had some mentors who had some pretty good success, but it was difficult because their approaches weren't quite accepted or what was in vogue at the time. And so I remember sitting in one of my first musculoskeletal lectures for equine, and Dr. Belknap, who is a expert in lameness and podiatry, is a surgeon at Ohio State. And his opening lecture was, our treatment for laminitis hasn't improved in the last 100 years, mm-hmm. And so to me, it was kind of a knife to the heart a little bit, but so I think that your assessment is right. I think that there's a couple different types of laminitis, and understanding that really dictates how you cater your both your medical management and your mechanical management of the disease process. And so one thing I see a lot of, honestly, and this even happens in sport horses that you may not think of as your typical laminitis horses, but that's a mechanical laminitis, right? So all laminitis really means by definition is inflammation of the lamina. Okay, so anything could cause that. And one of those things is the horse has a certain threshold of what the lamina can hold, and it's about 400 pounds per square inch, right? So
just most people know what the lamina is. What we're talking about the lamina is the thing that glues the bone to the nail.
Yes.
It's just like our nails, right? Mm-hmm. So whatever glues the hoof wall to the bone. Yep. Just to make sure we're clear on that, everybody understands.
Yep.
And by the way, we have a great ebook. It's called Equine Food Secrets, and you can find that equinefoodsecrets.com/ebook. It shows really nice graphics of that. All right, sorry to interrupt. Keep going.
So there's a normal threshold that bond, basically, microscopically, it looks like a zipper, right? Mm-hmm. And so if you have the bone on one side and the hoof wall on the other side, there's a certain amount of tension that can hold, which is important, right? Well, when you have a horse that exceeds that threshold, then it can cause damage to the lamina. And so I even see horses that are actively competing that their feet are overloaded. There's a way to calculate surface area and from the bottom of the foot, and basically you just kind of use the old circumference pi r squared, and the body mass, and normal range is about 60 to 78 pounds per square inch.
Lots of physics in this lecture.
So anything above that will cause that bond to fail, right? Just because it's like putting too much weight in the back of your half-ton truck. That's the first type, mechanical laminitis. That one's usually a little bit easier to manage because once you recognize it and you do things to increase support in different ways, then those horses generally snap out of it pretty quickly. The other category is more of a medical laminitis. And if I was to draw a flow chart under medical, you would have the illnesses like, so either endometritis or stillborn, mare with a stillborn foal, things like that, retained placentas, even Potomac horse fever. So you have some underlying medical condition that's causing a huge inflammatory response. And unfortunately, one of the places that a lot of those inflammatory cells kind of settle out is, in the hoof. And so that causes really bad things to happen. The second type under medical would be metabolic, right? Okay. So these are your Cushing's horses. These are your insulin dysregulation horses, those types of things. Where those horses are a little more challenging is you have an underlying pathology that will kind of continue to require treatment, or else the disease is going to come back, right? Because those are usually long-standing. It's not like a horse that maybe had Potomac horse fever. Once you clear the infection, now, the lamina can start regenerating and you can have, move forward. The metabolic types, they're always going to have that insult that's going to make that bond weak. And so long-term management is a lot different.
Is there a third, or those are the main ones for you?
No, those are pretty much the main ones. I mean, I'm probably forgetting something, but...
Oh, we probably can talk about support limb laminitis.
Sure, yeah. So that would be more under mechanical.
Mechanical, yep. Got it. Perfect. So let me tell me a little bit about now. Everybody hears the word laminitis, and of course, is it safe to say that most horse owners and trainers just hear that word and think of one thing, don't think of all the different ramifications? A safe assessment?
Yeah, no, okay. That's pretty safe, I would say.
Good. So now we have a client, the horse has laminitis. Mm-hmm. And of course, everything that they taught us in vet school was like, oh, you have laminitis, it's a medical emergency, it needs to be treated. Not that we know what to treat it with 100%, but it needs to be treated, right? Sure. So the vet does some sort of treatment. Mechanically, shoeing-wise, as a farrier, what should the farrier needs to know when treating a horse with laminitis? What are the most important things that a farrier needs to know?
Honestly, I'd like to back up just a second, because I think one thing that your listeners could probably take from this is, what do we do in emergency situations?
Okay.
Right? Let's start there.
Okay.
Because I think that there's a few things that you can do because time is precious in this disease. For every 1 day lame, it's usually about a week's worth of recovery, in my experience. Right. Okay. So if you have a horse that you suspect is having a bout of laminitis, the very first thing I would do, and maybe even before you call your vet, okay, is I would put some sort of frog support on your horse's foot. What I suggest people use, it's very easy to cut a triangle portion of, like, say, an old stall mat and tape that to your horse's frog, okay? It's a very good way, because what you have in laminitis is, if you imagine a cardboard box on a concrete floor and the floor's wet, you go to pick that box up from the edges and everything collapses through the middle, right? So what you want to do is you want to get a scoop shovel and lift through the center of it. So that's what the frog support is going to do, okay? So generally what will happen is those horses will be slightly improved after you do that. Then you call your vet. I mean, do it all in the same time, but that will buy you precious time and you can do that if it's got shoes or not. If it doesn't have shoes, either way, you want to increase the frog support and not the sole. You don't want the sole bearing weight, because what happens is that there's a whole vascular bed underneath the bone that's inside the hoof. And one of the things that causes both pain and failure of laminitis cases is vascular compromise, right? So
Meaning not enough blood flow.
not enough blood flow, because that's where the hoof gets its nutrition. So if it doesn't get nutrition and it has this huge inflammatory thing going on, that's why they really go downhill quickly. So first thing is frog support. Next thing is get a hold of your vet and your farrier, right? The thing that I try and impress upon vets, both veterinarians and farriers, is at this point, it's better to be more conservative as far as how much we trim off the foot, because, and there's some papers out there that I like to utilize that talk about the bad effects of changing hoof angle too much all at once. And that foot needs to have a certain amount of vertical depth to it, right? Mm-hmm. To allow that circulation to reach the bottom of the hoof and perfuse the rest of the foot. Because believe it or not, the hoof is fed from the bottom up. So the arteries that come down into the foot, they come down from the bottom and then leach kind of up and out. So if you pinch the bottom of it, you're actually pinching the whole portion of the hoof, right? So I think that's being conservative, and there's some numbers to that, because Dr. Redden's done some research with venograms where they inject dye into the foot, and he found that anything less than about 15 millimeters of vertical depth, of sole depth, you don't see that vasculature on normal horses. That doesn't even account for in laminitis, right? So
there's tons of value right there. This could save your horse's life. For every 1 day lame, expect about a week in recovery. Sure. Put some frog support just in the front, and you can get it. Use a triangle from the stall mat. That's great. Great information. And to better be conservative. So don't go crazy starting to put sugar when it's just happening. Don't start removing food, quoting trying to do some. Let it settle. I see people get really, really aggressive way too early on in the disease process, that they want to make x-rays look, perfect. And I don't think that always does good things for the outcome.
Makes sense. 100%.
Just let the body adjust to this new program. And that doesn't mean that you don't support the foot. You don't have to get aggressive with support. But changing the hoof capsule, I think, can be kind of dangerous in the acute phases of it.
Yeah, awesome. Thank you so much for those tips. This was definitely tons of value for any horse owner, any horse trainer, for you, anybody that has a horse. I hope you enjoy our podcast with Dr. Adam, and stay tuned, because we're going to have more. We're going to bring you into this show. Thank you so much.
Thanks. I appreciate it big time.
If you have any questions, if you want that article, don't forget that it's going to be on the link notes. And if you have any questions, just give us a call, 352-307-3690. We are here to help you out. And if you liked us, if you like what you've heard, give us a thumbs up, give us a review. If you don't like it, I'll happily change it. Thank you.